I think certainly the idea that the vaccine is safe is really one that is shared by everyone. There are millions and millions, hundreds of millions actually, of vaccine doses that have been administered. And there's very good safety data from around the world, but most specifically from Israel, where they have better data than almost anywhere else, showing that less than 0.25% of people have any side effects whatsoever that come to medical attention, and even those are really quite minor. So I think everybody can be really confident in the safety of the vaccine.
We have to recognize that there was global efforts mobilized to make the development of these vaccines happen and their studies done. But no corners were cut at all during any of these trials. It was simply the fact that there's not usually a need to mobilize so urgently, so globally, and so quickly to get something done. And so no corners were cut.
The vaccine you can get the fastest is the best one for you, because all the vaccines are extraordinarily effective in preventing serious illness and death.
So unfortunately, people have become understandably fixated on these initial numbers from the clinical trials. So what is that 60% and that 90%? That was symptomatic COVID-19. So when they did the clinical trial, they give vaccine to individuals, they followed them up, and they asked people to report whether they had symptoms. If people had symptoms, they presented to get a swab of their nose, and if they tested positive, that was recorded as an outcome. Now you can imagine symptomatic COVID-19 ranges from everything to a mild upper respiratory tract infection. In fact, some people are often asymptomatic or very close to asymptomatic, to everything from the tragic outcomes like ending up in an ICU or dying. And those are the outcomes we care about. And all the vaccines have comparable efficacy when it comes to those major outcomes. There really is no good vaccine or bad vaccine. And I know people have a hard time believing when we say the best decision you can make for your health is to take the first vaccine you were offered, but certainly do not, I would strongly encourage people not to defer vaccination based upon the one that's being offered to them on a given day.
So really, all of these vaccines have gone through a rigorous research process, a rigorous Health Canada approval process. They're all safe and effective. And I think what people really need to understand is that the best vaccine is the earliest vaccine that you can get. And it really doesn't matter which vaccine you get.
It is really important that people who are either immunocompromised or on any medications get this vaccine as soon as possible. And it's actually unfortunate that some of the guidance that came out from NACI and our National Immunization Committee actually highlighted those conditions as needing to have some kind of discussion with your family doctor. But I don't think that's actually necessary. In fact, that discussion would really be your family doctor or your specialist saying, I really think you should get this vaccine. There aren't any additional side effects that have been seen in those people. It doesn't present any additional danger. In fact, as I said, it is more necessary, but because it wasn't studied in those groups, we weren't able to say things about it that is in fact safe or efficacious. But all of the evidence we have over the tens of millions, hundreds of millions of doses that we've got does indicate that it is both safe and really important and effective that they get that vaccine.
Women who are pregnant are at very, very much increased risk of having bad outcomes from COVID. So if you're pregnant, you get COVID, that's a real risk to you and your fetus and your baby. So that's the first thing to know. If you are, furthermore, if you're pregnant, then you want to know, is it safe? And here's what we can tell you. It appears fairly clear that it is safe. We have tens of thousands of women in the States who are pregnant in registries now with really good safety data. And so that's really, really reassuring. And then we have biological data that is reassuring. It seems that nothing from the vaccine crosses the placenta, but what does cross the placenta is the antibodies you make. So if you get vaccinated when you're pregnant, you get to hand off that protection to your baby when your baby's born. And that's, what more do we want to do than that as a new parent?
And the holidays are coming now. Pesach is coming. We all really miss our loved ones, and we want to see them and hug them and kiss them. That being said, the first dose isn't fully protective. And the community levels of COVID are quite high right now, especially with the new variants. So the public health recommendation right now is to continue to practice physical distancing. So even though you've been partially or even fully vaccinated, it's recommended that everyone wears a mask, that you keep a 2 meters distance, and that as much as you can, try to spend time outdoors instead of indoors.
Do not congregate. That's a very bad idea. So even if granddad, grandma have gotten the vaccine, their antibodies only start to be produced about 2 weeks after the vaccination, and they only peak at 6 to 7 weeks. And so by the time that Passover comes, they will not have had produced enough antibodies to be safe. That's first. And then second, if you congregate, you are going to be spreading the virus amongst yourselves if you are positive. With the new variant being very dangerous, even younger people can be at risk for getting severe illnesses. So I know that it's very difficult. We all are fed up with this, but it will be hopefully the last Passover through Zoom. And hopefully by the summer, this will be the end of it all.
So please, this year for Pesach, your own household only, use virtual things like Zoom to connect with your family and friends, and just do this a little longer. If we all do this together a little bit longer, and we stick to the restrictions and we listen to public health, we're all going to be in a much better place come the summer and come the fall.
This has been a very tough year for all of us, and it's not over yet, but there is a light at the end of the tunnel, and I think the way out of this is with vaccinations. I think that's pretty clear.
I too share in the people's sentiments of wanting to open up and return to normalcy and be done with lockdowns and all the precautions that are still being advised. Unfortunately, we're still in a state here in Canada where most people are not vaccinated. And in conjunction with the fact that there are now new variants that we're having to deal with, and we're entering a third wave of COVID at the same time, it's unfortunately not a time when we can return to normal life as usual, as most of us would like to do.
As it says in the Haggadah, it's Lashana Haba B'nei Chorin. We're not quite there yet. It may be next year, or certainly not this year, this Pesach, when we're completely free to do whatever we would like to do in terms of celebrating. So just to keep that in mind.
I think I want to urge any listeners to think about how they can play a role in ending the pandemic. And one way they can do that is to get their vaccine. The next way they can do that is to tell their friends and family that they got the vaccine, and to help their friends and family to get the vaccine. So, I think this is a way in which we can do tikkun olam. Actually, we can get back to normal. We can heal the world by building up immunity in our community.